Welcome to today's GNCC Espresso Live with our distinguished guest, the Acting Medical Officer of Health for the Niagara Region, Dr. Hirji. Dr. Hirji, thank you so very much for being with us today. My name is Mishka Balsam, and I will be your moderator for the next hour. While organizations and governments are responding to the ever-changing pandemic impact, businesses have questions, and we're privileged to have Dr. Hirji with us today for today's GNCC Espresso Live, which takes place on a monthly basis, especially during these critical times. For those of you who have been part of the monthly updates with Dr. Hirji, probably know the format, but for those of you who are newly joining us, today's format will be that Dr. Hirji will provide an update, which will be followed by a very interactive question and answers. So if you wanted to, at that time, utilize the chat function or the raise the hand function, either way works for us. And many of you have already actually submitted some questions, and we're looking forward and are committed to getting to most of them today. And on that note, Dr. Hirji, I'm going to pass it over to you.
Thank you for that. And thank you so much again for the invite to come and speak with all of you today. You know, I think we're in a probably pretty important point in this pandemic and hopefully a transition point to better times. So I'm going to give you an update of what I see the lay of the landscape. And I'm actually going to spend a few moments at the end to really provide a little bit of advice of what I think is going to be important for workplaces in the next little while to focus upon. So hopefully there'll be a little bit of practical advice there that everybody can take away as well. So I'll just get started here. And, I think, thank you for those who sent questions in advance. And I think a lot of what I'm seeing in the questions is people are picking up some of the global pattern that we're seeing right now of cases going up in other countries and are particularly worried about a fourth wave. And I just want to start off by just going into a little bit of what we are actually seeing around the world. And I think just highlighting that there is a very real concern here that we could see something along those lines, but also that we're not there yet here. And I think there are things that we can do hopefully to avoid that sort of outcome here. So, everybody's probably seeing similar headlines to this. This is one of the ones earlier this week around the US stock market when it took a bit of a dip, I think on Monday. And that was very much linked to, fears about a new wave or a new surge of COVID-19 cases that they're experiencing in the US. And I think, you're holding these sessions because I think all of your members really recognize that the health of the public and the pandemic really has a huge impact on business and the economy. And I think this was another event that really reinforced that. If I just take a quick survey around the world, and this is looking really, over the last month from June 23rd to July 19th, the 4-week period there, what has happened with cases in countries around the world? And I actually had originally built this graph a couple of weeks ago, and I decided to update it now. And this is sort of what it looks like in terms of what's happened with cases. And you can see across the world, there's lots and lots of countries where we're seeing, unfortunately, increases in cases. These 4 countries here are actually a bit off the charts, and I'll just go to them in a second here. This is because I set this graph up a couple of weeks ago when things weren't quite as high. But the good news here is that when you look at outside in Ontario and in Niagara, we're at this point bucking the trend a little bit, and I'll talk a little bit more about that later. Just to kind of, blow up this graph a little bit so you can see those other countries here that are really very high. It seems to be a pretty consistent pattern across the world. And part of the pattern here is people are probably quite familiar with the UK and the US who have, really opened up their economies. Similar stories in places like Netherlands and Spain. And I think that is a big part of what is leading to that, coupled with, of course, the Delta variant, which spreads more easily. The few countries I want to just take a little bit of a deeper dive now very quickly, and they're going to be the UK, the US, Netherlands, Spain, and Israel, because those are countries that have, in the ballpark, similar vaccination rates to us, and I think they provide the most direct examples of what we might, be facing. So, starting off here, we have Israel. Israel was really the world leader of major countries in terms of getting vaccines out. You can see we in Niagara have actually managed to get ahead of them in first doses. We're still catching up on the second dose front. That number is still rising, and I'm hopeful that within the next couple of weeks we'll actually catch up to Israel on that second dose number. But Israel, for a while, you can see here, we started vaccinations in December. They really drove their cases very low and actually had them close to zero. And they fully reopened for a period there, and you can see, cases are starting to go back up as they start to see another wave. And the lesson there is that this level of vaccination, while pretty good, wasn't enough to keep cases down if we have a fully reopened economy. This here would be the United States, which I think we hear the most about. And you can see the US was able with vaccinations to bring their cases down, but of course they're seeing going up. US isn't doing quite as well as us in vaccinations. I think they were ahead for a while, but we have very much overtaken the US. This is just a bit of a deeper dive of what we were seeing in the US. These are a couple weeks old now, but this is looking across different states. And this gray line is looking at cases of COVID-19 excluding the Delta variant. And then the red line here is looking at just the Delta variant. And you can see sort of a consistent pattern across all of these states where you were seeing a decline in the non-Delta variant cases, the vaccinations and what remaining measures they had to restrict social interaction were being very effective at driving that down, but weren't quite as effective with the Delta variant because the Delta variant spreads more easily and is more difficult to control. But for a while, there's very little Delta variant, so you had an overall trend in the US of cases were coming down because you had the non-Delta variants really dominating. But at some point, of course, the Delta variant catches up and takes over. And now in the US, there's very little of the non-Delta variant. It's overwhelmingly the Delta variant, and that is basically reflecting now in terms of cases going up because they're not successfully managing to control that Delta variant. And of course, as cases go up, a percentage of people are unfortunately going to be those who have severe outcomes and get hospitalized. And there was this headline a couple of weeks ago in Missouri about them running out of ventilators in their hospitals. And so their healthcare system is once again being quite affected by the increases they're seeing in terms of cases. Very quickly here, the United Kingdom, another world leader in vaccinations. You can see Niagara, we've just managed to beat them very recently, just a hair ahead of them now. And they're, of course, seeing the biggest surge here of new cases. And you may have seen this weekend, they have decided to nonetheless proceed on with completely dropping all COVID precautions despite this increase going up. And so unfortunately, that doesn't give me a lot of confidence that they're going to see this peak and start to come down anytime soon. And I think they're really banking on that with vaccinations, hospitalizations won't be as high, and they're gambling that they'll be able to manage that. Just to show you what the UK was seeing, a month or so ago, it's a very similar pattern to what the US was seeing, where you have this gray line of the non-Delta variant cases coming down. The red line of the Delta variant cases is going up, and eventually it dominates. And in certain regions it had taken off earlier, and that has slowly spread to the rest of the country. And while the UK is banking on hopefully not seeing an increase in hospitalizations, their chief medical officer is warning that there is some real risk there. So it is very much, I think, a risk that they are hoping that they will get away with. Netherlands here, just quickly showing another country that's done very well at vaccinations, very similar to us in first doses. We're a bit ahead of them in second doses, and you can see there likewise have seen that big increase in cases. And then Spain, another European country, similar to us in vaccination rates, we're a little ahead of them, and they're of course seeing another big increase. And so, the big lesson I'm taking from here is that the level of vaccinations we have right now is good, but it's not quite high enough that if we were like these European countries or Israel and we fully reopened our economy, that we wouldn't see another wave. And the lesson there is that we need some combination of probably some ongoing restrictions on social interaction and some additional work to get vaccination rates higher before we can take that step of fully reopening. But that's, of course, not to say we can't partially reopen and keep taking steps forward, just that we can't say that the pandemic is over and we've hit that end game. And just, before I, leave off to talk a bit more about Ontario data here, I just want to highlight, BC and Alberta as two provinces that really have taken that step of pretty much dropping all COVID precautions, no more masking, no more physical distancing. And you can see headlines showing that cases are starting to increase in both of these provinces. I've talked in the past about the reproductive number, and I know you actually in your emails that go out to the membership talk about the reproductive number in Niagara as well. And that reproductive number is a number that hopefully is around 1. If it's 1, that means for every case of COVID-19, that person is going to spread the infection to one other person. So if it's around 1, you're going to stay flat with cases. If it's above 1, cases are going to multiply over time, which is exactly what we're trying to avoid. If that reproductive number is below 1, that means cases are going to decline, which is obviously ideal. And this is actually a set of calculations done yesterday looking at that reproductive number across provinces. And you can see BC and Alberta, who are the provinces that have aggressively reopened, are seeing that reproductive number well above 1, which I think is reflective of those headlines I just showed of cases starting to go up. We in Ontario are effectively still around 1, so we're with a bunch of provinces where we're successfully keeping things flat right now. And then there's a few provinces that are able to have that number a little bit below 1 right now. And just highlighting BC, Alberta versus Niagara's vaccination rates. BC a bit ahead of us in first doses, but we're pretty similar, if a little bit ahead of those provinces in vaccinations, but not massively ahead. So I think we would potentially be at risk of seeing something similar if we follow the route of those provinces. Now, of course, the good news here is that all of these trends of cases going up aren't what we are seeing right now here in Niagara. This is what our case curve has looked like in Niagara. With that third wave, we've come down with cases and we've seen them continue to go down. Obviously not going down as steeply, but obviously getting to, once you're down to the last few cases, it's very hard to get, the same speed of decrease. The good news is we still seem to be on a declining trend here. Underlying that, though, is that our cases at this point are pretty much all the Delta variant. This is data we have on our website showing over the last 14 days a breakdown of our cases. We have about 25% of these cases have been confirmed to be the Delta variant, and then around another 75% of them are likely the Delta variant based on screening results, not definitive like these 25%, but probably. And I think that reflects that the vaccination levels we have and the social interaction restrictions that we have in place have actually pretty much wiped out all the other variants of the virus. They've been enough to basically prevent those other variants from really being able to spread, and we've basically wiped them out. The Delta variant, which is the most easily able to transmit and the hardest to control, is the one that's lingering on. But as I showed, we still seem to be slowly driving it down, so we're still having success against that Delta variant for the moment. Switching to the Ontario-wide trend, and it's pretty similar here. You can see downwards trend, and it's still probably going downwards, but just here you can see it's maybe flattened out just a touch. And Ontario-wide, we're probably sitting around a flat trend, which is consistent with that reproductive number I showed of just about 1. Similar in Ontario-wide is over 90% of cases are now the Delta variant because everything we've been doing has been successful to basically wipe out those other variants. The Delta variant is the one that's able to persist, remains around. But Ontario-wide, it's being kept flat, which is okay. We are at a level of cases that's manageable. We just need to be careful going forward that we don't, repeat mistakes that other countries have made that led to their increases. So we can hopefully keep this flat and maybe get it onto a downwards trend. And I'll just show this graph here quickly. These blue cases here basically are cases that reflect these 2 mutations, which were associated with the alpha, beta, and gamma variants, the variants that came out of the UK, South Africa, and Brazil, which was really what we're seeing through the third wave, as you can see, where almost everything was these blue lines. The orange line is where they don't detect those variants, which used to be all the non-variant cases. Now it actually reflects the Delta variant cases because the Delta variant doesn't have these 2 mutations. And so this orange line here that you can see is flat is basically the Delta variant. The blue line is largely the alpha variant and the other variants. And you can see that blue line, there's really nothing left of that blue line. It's basically the same as the orange line now. So what we have in Ontario now is basically Delta variant only, and we've managed to keep it flat. So we're not seeing cases going up. Unlike other countries where you had that gray line of non-variant cases coming down and the Delta variant cases going up, we have our non-variant cases have come down, but we've kept that Delta variant line flat. We haven't seen it start to go up. So we're in a relatively okay position as a result of that. We are not yet seeing the situation other countries are. But of course, there's an opportunity for that orange line to start to go up similar to other countries. And now to put up this graph here, we have the virus's inherent ability to spread that is trying to push that line upwards. And there's a whole bunch of things that we have in place right now, which is basically pushing back down on that line. And the result is that we're keeping things flat. We have, of course, our ongoing economic and social restrictions. We have border controls to limit people from other countries coming in and bringing infection with them. We're doing lots of physical distancing. Lots of businesses, of course, have reoriented their operations around this. We're still wearing masks quite a lot, especially indoors. And we're vaccinating more and more people. And that's, of course, limiting the ability of COVID-19 to spread and the Delta variant to spread. And right now, we're kind of in this balance where the virus's ability to spread is being balanced by everything we're doing. So Ontario-wide, we're keeping that Delta variant line flat. In Niagara, it looks like it's maybe going down very slightly, but we're doing okay here. And I think, the goal in the next little while is, of course, we're going to keep trying to get those vaccination rates higher and higher. As we do that, of course, that puts more on the top here, pushing down on that line, which is going to give us room to continue decreasing the economic and social restrictions and slowly decreasing some of the border restrictions as well. And so we've kind of got things in a balance. And our goal right now is to keep this balance going, that we keep getting vaccination rates up, we keep lowering the social restrictions, we keep opening the border up more. And I would propose we leave mask wearing and physical distancing in place as relatively low economic cost measures that we can continue in place. And we keep lifting the ones that are having the most impact and the most harm to our society as a whole. And so I think that's the kind of balancing act that we are going to be playing going forward. Keep pushing the vaccinations up to give us room to keep decreasing these restrictions. And I very much believe we need to take it as sort of a stepwise approach that, we lower some of these restrictions and we need to see what happens for a few weeks to make sure we're not seeing that Delta variant line start increasing. And if we're seeing it okay, and of course, over that time, we're getting those vaccination rates up a little higher, we then can take another step and pull away a little bit more. And we keep taking those steps forward and making sure that we don't give that Delta variant an opportunity to go up. And of course, if we see things starting to go out of control, we can hopefully then act early before it's too late and before we actually see another wave caused. Now, obviously, the ultimate goal is we'll eventually lift all of these restrictions when we get the vaccination rates high enough. And there's some modeling done by the Public Health Agency of Canada here that I think can give us a sign of when we might get to that stage. So this is, some earlier modeling that they had done that if we didn't have the Delta variant, if we reopened our economy right now, this black line is hospitalizations. And you can see hospitalizations wouldn't really go up if we weren't dealing with the Delta variant. This red dotted line would be the max number of hospitalizations our society could handle. And, we'd keep hospitalizations pretty flat and we'd be doing okay. Unfortunately, with Delta variant now being overwhelmingly our cases, we are in a little bit of a different situation. If we reopen, you can see that black line shoots up with hospitalizations. Of course, cases are going up before the hospitalizations go up. And you can see that black line comes very close to that red dotted line. So we come very close to our ability of our hospital sector to manage. And you can see these gray lines here. This is really, thousands of simulations being run in modeling, and then they're drawing the average line, which is this black line. So there's actually lots of simulations where we actually exceed our hospital capacity. And so right now, we're not at a stage where we could fully reopen and not see our hospital sector possibly overwhelmed. This modeling here, though, shows that if we get our vaccination rates up here, if you look at the fine print, it's talking about 83% of those who are age 12 and up get their second dose. We get to a stage where we reopen, we see hospitalizations go up a little bit, but nowhere near hospital capacity. And so that gets us to a point where we can pretty much reopen everything and it'll be manageable. We will see cases go up. We will see hospitalizations go up a little bit. We'll be at a level we can manage where we don't need to worry about having to come back and do some really severe economic restrictions because our hospital sector is threatened. That's if we get to that 83% of people age 12 and up who've got their second dose, works out to around 75% of the total population being vaccinated with 2 doses. So where do we stand right now here in Niagara? So, this is the eligible residents. That's the age 12 and up. This is all residents looking at everybody. So we need to get that to 83%. We're getting close, or this one to 75%. So, we can see that we're only about 5 or 6 percentage points away from there with first doses. We, of course, need to get them all back for a second dose. We're a little bit further to go with second doses, but that number is still increasing. So that's kind of, I think, the end target here, that we need to get these 2 numbers up to 75, which would mean these 2 numbers are 83. And that gets us to the point where we can largely drop almost all economic restrictions and be able to start to return to something much more normal. Until then, I think we take the slow steps forward where we keep getting the vaccination rates up, we keep pulling back on the social and economic restrictions, allowing things to start, the economy start to recover. And then once we get to that 75% here, everybody has 2 doses, we'll be able to fully reopen and really get back to, I think, something much more closer to normal. If you've been following our vaccination stats, you probably saw that, early July, we're doing close to 8,000 doses a day. And unfortunately, that has tapered off a little bit of late. Partly, we had a big influx of vaccines right at the end of June. Moderna's contract with Canada, I think, was about for 12.3 million doses of vaccines through the first 6 months of this year. And they were only delivered around 5 million or so by the middle of June. So they basically flooded us with over half of their promised allotment for the first 6 months of this year in those last 2 weeks. So we had a whole bunch of vaccine coming in right at the end of June, which meant we were able to really scale up the amount of vaccine we were able to deliver through the first part of July, which actually really, I think, moved our vaccination program up by a month. And we're probably a month ahead of where we would have been otherwise. What we've seen since then is, of course, we no longer had that excess vaccine. So we came back down to similar to what we were before that. Really since this weekend, we've, I think, hit the point where we've saturated the early adopters who want to be vaccinated. We've no longer seen people signing up for appointments as readily. So we've gone down from doing the 5,000 to 6,000 vaccinations a day to more like 3,000 to 4,000, where we still actually have some appointments in our clinics. That has meant we've actually now opened up our vaccine clinics to walk-ins to start to, make sure that that capacity gets used. And what we're going to be increasingly doing in the coming weeks now is reallocating our resources away from these mass vaccination clinics, still running the mass vaccination clinics, but not at the same capacity, and instead having those people out doing other vaccine opportunities to try and target areas where people are less likely to be vaccinated, but also areas where people tend to be congregating, and trying to basically make the barrier to vaccine as low as possible. I think there's a group of people out there who are opposed to vaccine or uncertain, but there's also a big group out there who I think are just a bit complacent. They're fine with getting vaccine, they're willing to get it, but they're just not willing to do the work to go sign up and book an appointment and plan all that out, or it's not top of mind because they have a lot of other stuff going in their life. And that's the group that we're really hoping will get us to that 75%. And I really do think that we could get well past 75% just by getting that group. So the goal is to really try to do a lot more outreach work, really make getting vaccine as easy as possible, capture, captive audiences to really offer the vaccine where they are anyway. So the effort to them gets as low as possible, and we're able to get those numbers up to that 75% in the next, little while. So that's where we're headed with vaccination. Last thing I just want to quickly talk about is where we're seeing cases of COVID-19 in Niagara. So this is our active cases right now, and a breakdown of where they are. The biggest pie here, 71%, is that cases living out in the community, not really associated with any particular workplace or locations where we have had outbreaks. The key thing I really want to highlight here is this 12% bit of the pie here, which is actually workplace outbreaks. And so you can see that workplaces are sometimes a location where we do see spread of infection. As we continue to try and get cases as low as possible, I think this is an opportunity that we hopefully want to zero in on. And of course, many of you are running workplaces, so hopefully you can be important partners in that. Just looking at our data another way, you can see most of our cases are people whom we can actually identify a close contact. Almost 2/3 of our cases, we can track down to someone who is a case who was in close contact with them where they got infection. There's a bit of a slice of the pie here that is international travel. There's a group here that of our current cases we're still investigating. There's only a small bit of the pie here where people have gotten infection and we're not really able to figure out why. So the good news is in many cases, we actually do know where that infection is coming from. And when we zero in on that, households, if someone in your household is a case of COVID-19, it's a very high chance you're going to get it. The 7% bar here is, you're going to get infected from a friend. This 14% here, another member of your family who doesn't live with you. What I really want to focus on here, though, again, is this, blue bit of the part here, which is coworkers. About 12% of people are getting infected by coworkers, and that's really matches up with what we're seeing in workplace outbreaks, with almost everybody is a coworker. And I think is an opportunity that maybe this audience can help with, addressing that 12%. This is just another way of looking at it in kind of the settings where people have gotten infected, and you can see again, 12% is infection has happened in workplaces. I think that's all I'll say about that. You can see, of course, lots of family gatherings, non-family gatherings. That tends to lead to a lot of spread of infection. So, when we think about COVID-19, it's largely spread through the respiratory droplets and aerosols that we breathe out. Droplets are generally considered to be these heavier ones that will quickly fall to the ground. And so the whole idea of physical distancing is you're 2 meters away, so these heavier droplets fall to the ground and can't really infect someone. What we've increasingly seen, though, is that these very fine droplets that are smaller than 5 microns, they can actually float in the air for a little bit longer. And these are what we call aerosols. And they play a role with spreading COVID-19 infection as well. And of course, 2 meters distance isn't going to be enough to stop them. Masks actually do play a role in helping stop them, especially if a person's infected and they're wearing a mask. That's very efficient at stopping those aerosols. But also, if you happen to be wearing a mask around someone who has breathed out some aerosols, that's going to protect you. Likewise, eye protection will prevent those aerosols from, touching your eyes, and that being a way it can enter your body as well. And so those masks, I think, are really important for that reason. But if we're thinking about stopping spread of infection in workplaces, we're really, wanting to stop that transmission from droplets and aerosols as much as possible. And, there's, I think, a few things that I would highlight for the group here. We often see that infection probably is spread between people during breaks and in break rooms. So when people are on the job and they're working, workplaces have done a really good job of putting in protective measures in place. They have plexiglass barriers. They're making sure employees are wearing masks and eye protection. They've, spaced people out appropriately. Things are going really well while they're actually on the job. When they go on break or they go into the break room, that's when some of these things fall apart. People are more likely to sit closely together, interact socially. Often, of course, in a break, you're going to want to sip some coffee or have a snack, so you're not going to be wearing your masks. And that's really where we're seeing some of, a lot of the risk, and probably what's driving some of these workplace outbreaks. So one thing I would really advise is that as much as possible, make sure to ensure your employees are aware that there is risk during breaks and when they're in the break room. Make sure to structure break rooms so that people can be spaced apart. If you can open a window in the break room to create some more ventilation in that room, that's really good to help those aerosols kind of filter out and not concentrate in that room. Doing some of those steps can hopefully make these breaks and break rooms a bit safer. And ideally, you'd even have employees not spend time in break rooms, but actually go outside where it's even safer, go take their breaks on their own, so there's not that risk of infection spreading between people. Vaccination is eventually going to be our pathway out of this pandemic. So anything you can do as a workplace to encourage and facilitate vaccination is very much appreciated. I think if an owner, a business manager, supports vaccination, that's going to have an impact on employees. If you're able to give employees time off to go get vaccinated, that could maybe be the difference of them going and getting vaccinated versus not getting vaccinated. So anything you can do along those lines, very much appreciated. If you want to have your employees all get vaccinated at one of our clinics, we're happy to set aside a time where you could have all your employees show up at that dedicated time and all get vaccinated together. Masks, I think remain something important. And I think this is one of the things that we really shouldn't step away on. Masks are not the most fun to wear, a bit annoying, but they have pretty much no economic cost. And I think that's one of the measures that we should really keep up as long as possible, because it's low economic cost and I think it makes a difference. One thing just to highlight is that make sure people are wearing masks appropriately. None of the stuff where that mask is, falling below the nose. Ideally, a mask should have a bit of metal around the nose so you can properly mold it around the face, so you don't have gaps where if someone is unfortunately infected and they're breathing out aerosols, you don't have those aerosols kind of blowing past that mask. You want that mask to make sure it's capturing all of those. And likewise for the other person who isn't infected, you don't want their mask to have spaces where that aerosol might get in and potentially infect them. So just really encouraging people to make sure they wear their mask properly would be good. Something we've seen is often eye protection isn't being worn. It is part of the provincial regulations that if someone is within 2 meters of others in a workplace, they should be wearing eye protection. So make sure that's available for employees in your workplace if they have to spend time around others within 2 meters. Likewise, periodically you should disinfect those eye protections. So when people go on break and they're taking off the eye protection, if there can be some, disinfectant wipes for them to quickly wipe down that eye protection, that's really good. Obviously, the goal of that eye protection is it's going to be blocking those droplets and aerosols, so it's not getting into someone's eyes. But if you're taking that off and you're touching it, now you're going to contaminate your hands and possibly spread that infection. So good chance to just disinfect it periodically so we don't have that spreading. Similar kind of message when handling eye protection or masks. If they've done their job, they've blocked infected droplets and aerosols, which means that the virus might be on them. So if you're taking off your masks or eye protection, always a good chance there to go use some hand sanitizer to make sure if anything got on your hands are clean and you're not going to spread it around. Really do encourage that in workplaces as much as possible, try to have policies in place so that if employees are sick, they don't feel pressured to come to work and that they feel supported to stay home and stay away from the workplace and not bring infection into the workplace. I know Ontario now has some paid sick days. It's obviously costly for a small business to have those, but anything they can do to allow those would be great. As well, if people are sick, remind them that there are some federal government programs still available to help people get some supplementary funds if they do need to isolate. And reminding of them that be helpful to make sure they stay home when they're sick and don't feel pressure to come into the workplace. Workplace safety plans, a requirement of the provincial regulations. We've seen these aren't always present, so make sure if your workplace doesn't have one that you have one in place so you're fully in line with the provincial regulations. And then lastly, there's been a lot of talk in the media around ventilation and filtration, and the whole idea of ventilation and filtration is around these aerosols. If you have better ventilation, you dilute those aerosols, reducing the risk of any spread in your workplace. Filtration is basically removing those aerosolized virus that might be in the air to make sure that the air is clean and as low a risk as possible for COVID-19. When I think back to that 16% of cases where we can't find a close contact, I really do wonder if that could be in places where aerosol has remained around. So someone isn't actually around someone they know who's infected with COVID-19, but that aerosol is perhaps what caused those infections. I think there is perhaps opportunity that if we improve ventilation and filtration, we can further reduce the risk of spread of infection. Of course, the more we reduce that risk, the more easily we're able to fully reopen our economy. And just some quick thoughts here that I think are practical bits of advice that can be taken away for a workplace to use when optimizing ventilation and filtration is The easiest type of ventilation to get would be natural ventilation. So as much as possible, if there's things that you can move outdoors, especially during the summer, that gives you that natural ventilation from the outdoors. So that's always encouraged. If you're indoors, if there's windows you can open and the weather permits, definitely open those windows. That's going to increase some of the ventilation. That's a cost-free measure that's hopefully going to reduce some of the risk in the workplace. When we then move on to some artificial ventilation, this is really about HVAC systems. And key thing is you want to make sure that the air exchanger on your HVAC is ideally running all the time. So you're always exchanging some of the air indoors for new fresh air from the outdoors. Some of the science says that if you're around 10 to 12 air exchanges an hour, that's really sort of the optimal to get at. So if you're able to have an HVAC system that does that, that's great. But whatever you can do, I think, is going to help. So key thing is if you have an HVAC system, make sure that air exchanger is running and have it running while people are in the premises to make sure that we are exchanging as much indoor air for the clean outdoor air as possible. Of course, make sure your HVAC system has been maintained, get someone in, at least once a year to make sure it's running optimally. And then finally, in terms of filtration, if you're not able to completely do this ventilation, at least with your HVAC system, if your system will support MERV 13 filters or higher, that's really optimal because that's going to remove most of the virus that could be in the air. So if your system's able to do that, definitely make sure you upgrade to those filters. And of course, change those filters regularly. And if you're not able to have an HVAC system running, or you don't have good filters, or you don't have windows open, bring in portable HEPA air cleaners or purifiers into the space can actually do quite a good job of filtering the air as well. And some of these aren't that expensive. They're only, $300-400 and could actually filter the air in your room. Obviously, there's going to be an electricity cost to that, but this could be hopefully the difference between employees and customers getting sick and us being able to keep your workplace safe. So if you do have a workplace that doesn't really have options for much natural or artificial ventilation, or you're not able to use good filters in your HVAC system, I think this is definitely perhaps an investment worth considering to make sure you can make your workplace as safe as possible. So hopefully that's a little bit of practical advice you can take away on that front. And I've spoken enough, and I'm happy to turn it over to questions now.
Thank you very much, Dr. Hirji. It's been extremely helpful and informative, and has actually addressed some of the questions that people have come forward with via email and other ways in connecting to today's webinar. So what I just wanted to encourage all attendees, we've had a high number of questions that have come in, and we have about 20 minutes left, and we really are committed to getting to most of them and to address them. So thank you for those of you who have actually utilized the chat function. It's great to see them, the questions and comments coming in. And you also have the option of raising your hand, and we'll make sure to unmute you and you can ask your question live. I am going to start out by some of the questions that have come forward, and they are gearing towards the early part of your presentation, Dr. Hirji, and that is when it comes to variants. And those are also some of the questions that have come in via the chat. And what is the likelihood that we will see another variant other than Delta at this point? Are we hearing or seeing anyone that is likely stronger than the Delta one that we might have to deal with in the upcoming month?
Yeah. I think it's unfortunately very likely that we're going to keep seeing variants emerging. What I hope is we're not going to see one that's stronger than the Delta variant, but there's no guarantee of that. It's hard to know what is going to pop up with variants. What really drives variants emerging is that when infection is spreading, every time infection spreads, it mutates a little bit. And the more infection spreads, the more it's going to mutate, and eventually that infection finds a way to adapt to being more successfully able to spread, and you end up with a variant of concern. India really had infections blow out of control, and that's where the Delta variant emerged because there's so much transmission there. And so the way we eventually, get these variants to stop is really we need to get the rest of the world vaccinated as well. We're getting pretty advanced here. And as we hopefully get to that 75% first and second doses soon, and even higher, we need to really start to divert our effort to supporting the rest of the world to get vaccinated, so we don't have these variants keep emerging and potentially threatening us over the long term.
Thank you very much. That helps, and I think addresses about a number of questions that have come forward. The other question that is also relates to one of your slides, and it showed the number of active cases and where transmissions are taking place, especially as it relates to workplaces. And you had indicated that that's around 12% at this point in Niagara. Yeah. Can you kind of clarify for us, when we talk 12% of active cases, how many actual cases we're talking? And secondly, how many workplaces we're actually looking at, because we have about 13,000 places of employment here in Niagara. And just to give our audience a perspective, when we talk 12% of the workplace, because and the reason I'm also asking is that we often, employers often experience hesitations of employees going back to work because of the fear that it might not be safe. Yeah. And I think maybe we need a little bit more clarification around that 12%.
Yeah, absolutely. So this is analysis of active cases, and it's just a way to look at our most recent cases that kind of roll over, that someone's a new case after 10 days, they will, in most cases, resolve. Some people linger a little after that. And once they resolve, they're no longer an active case. That 12%, I think, correlates to about 5 or 6 cases right now, because we only have a little over 40 active cases, because our total number of cases that last a little while has been quite low. So it's not a really large number. I think it matches up to only actually a couple of workplaces right now. But of course, if cases go up, that percentage is, if it stayed the same, would start to mean more workplaces and a larger number of cases. I think when we're thinking about risk in the community, it's, there's a few components to it. There's the component of how many cases are out there. So what is the risk that someone could show up in your workplace who's infected? And of course, fortunately, that number is low, and hopefully we'll keep it low. The next component is, of course, what is the type of interaction occurring in your workplace? I've talked a lot about food premises, where, of course, people are dining, sitting close together without masks. That's a higher risk interaction, whereas a workplace where maybe you have people sitting in cubicles well spaced apart, maybe that workplace is well ventilated, that creates a lower risk environment. And then the final part is, of course, vaccination. If people are vaccinated, their risk of getting infected is far, far lower, and risk of spreading infection to others becomes far, far lower. And so, the things that we can control are getting people vaccinated, rearranging our workplaces to maximize that spacing, making sure people are wearing masks, improving our ventilation. And hopefully, as we can keep cases low, that's going to keep our workplaces safe.
Thank you very much for clarifying that. It's helpful, and I think it's helpful for most employers and employees, because many of us are going back into the workforce. We are seeing our colleagues more often. We're looking forward to it. So this gives us some clarity about what the actual number is. On that same topic, we have heard from a lot of business owners who are nervous about letting unvaccinated workers back into the workplace as things open up. We are convening a separate webinar next week exactly on the workplace safety question that often comes up, especially related to legal questions around this. And we invite everyone, we'll share a link in our chat in case you're interested in that aspect of it. But what can you tell us how much medical risk unvaccinated workers pose to each other, to vaccinated workers, and to the public if they're going back to the workplace? And this is a really interesting question again, too, because it's maybe you have looked at those workplaces where some of the outbreaks were and have maybe done some analysis of how many people were vaccinated versus not vaccinated.
Yeah, so what I can say with the current workplace outbreaks we're dealing with, that overwhelmingly it's people who are unvaccinated, a few people who have only had 1 dose of vaccine. I don't think we've had any people who've had 2 doses of vaccine. That being said, we do see the odd case of people who have had 2 doses of vaccine, but it's far lower than the people who are unvaccinated or only have 1 dose of vaccine. When we're looking at the Delta variant, which is really what we're dealing with the most, the UK data seems to show that once you have 2 doses of vaccine, your risk of getting infected falls by about 88%. So there's still that 12% risk that if you're, that you could get infected with COVID-19, but it's far lower. You're never going to have a vaccine that's 100%. So hopefully that gives some sense that if you have a vaccinated workplace, you've probably come close to reducing your risk about 90%.
Thank you very much. And for those of you who are in attendance who have questions, what can I ask of my employees? What rules I have to put in place? Again, we just shared our link for next week's webinar on it. I think those are very interesting, very important questions to ask, and I really encourage you to join us for that.
Yeah.
We're starting.
If I may just quickly on that, I think we may be looking at rules around requiring vaccination down the road. But before we get that, we can, of course, do lots of stuff, hopefully, to encourage and support people to get vaccinated. So if you can get the message, you can really set that this is something we believe strongly in our workplace. Hopefully, that'll influence some workers. If you can give people time off or facilitate them getting vaccinated, hopefully, that'll actually get some before we even need to go down the road of getting rules.
Mm-hmm. Actually, and on that note, and this is a message to our participants here, if you want us to promote that your workplace or that you personally have gotten the second shot, I'm really encouraging you, just tag GNCC in it and we will share it again. So we're trying to create a lot of awareness too and support those ones who have come forward to saying, I'm taking the first and I'm taking the second shot at the same time. We have seen, and you had spoken to this one as well today, that we are seeing a tapering off of a willingness to get vaccinated. And that is a hurdle, and you are looking at it in all different facets, and we're really appreciative of that. Do you think we will see the same here in Canada, that it will just be kind of tapped out, tapering off, and we might only get to a certain level and won't see it overcoming? And the group that I'm looking at is the 12 to 17, the 18 to 29. The numbers haven't shifted very much from last month to this month, slightly, but not probably to the same way that we would have hoped for as a month has gone by. What are we looking at?
I'm a bit optimistic that we're going to be able to get those numbers up to 75, and I think actually probably close to 80%. When I look at the survey data out there of people's willingness to get vaccinated, it's actually pretty high in Canada. The people who are truly unsure or opposed to vaccination comes down to, close to around 10% of people. So I think there's a big chunk of people who, for whatever reason, haven't been able to get vaccinated. A lot of it could be complacency, they haven't got around to it. I'm also mindful that for families that you have children, you might want to get vaccinated. There's all kinds of childcare considerations. Two parents might be working. There's a lot of juggling and complexity to go on. And maybe we just need to make, better opportunities for people to be vaccinated. We've thought about, should we offer some vaccine clinics where we actually have childcare there? So you can come with, a child who needs to be vaccinated and have a place to have the other two children taken care of for those 30 to 45 minutes. So now that we're not having this demand of people where we're just trying to keep up with the demand of people, we're really going to start to explore a lot more of those creative opportunities. We're exploring with our school boards again, we might even go into some schools over the month of August and run vaccine clinics there and really leverage the schools, credibility with their parents and children to really help them to, bring them in for some clinics there. Or even looking at things like, we see lots of young people go down to St. Paul Street and St. Catharines to, go out to bars on Friday nights and evenings. And can we run a vaccine clinic there? And maybe even partner with some of the local businesses that maybe you'll give a free round of appetizers to anybody who shows that they went to that vaccine clinic. And that might get people to just sign up so they can get their, free appetizers and get past the complacency of not getting vaccinated. So we're going to be looking at a lot of those kinds of opportunities in the next few weeks to hopefully keep driving that number higher.
Yeah, and a lot of our members are also pharmacists, run their pharmacies, and we've heard a lot of significant number of stories actually from pharmacists having gone out of their way, actually being available and making shots and vaccinations available and connecting with the community too. So I think there's many ways that we can get the message out. We have one of our participants who are asking, when will we see vaccines available for those under 12?
Yeah, I'm thinking it could happen by the end of this year. Both Moderna and Pfizer are doing the research studies on it, and they had a timeline of kind of end of September when those could be done. After that, they'll need to do the data analysis. They'll need to go to Health Canada approval, but I'm thinking, maybe late November, December, we could be back vaccinating the, 5 to 11 age group.
Thank you. Another question is, and I think this is often comes from those who have actually received both doses of vaccines, and it's related to what kind of official proof of vaccine document could be made available to them, and might not be even needed to be done by law. It just is something that's available that could be useful for them, and it could assist them in actually possibly doing some transactions, attending some I don't know, concerts, sporting events, or other things, but something that might make it easier for them and might be beneficial. It could be an incentive for those who are currently not vaccinated to also maybe have access to that or some privileges that are there.
Yeah, absolutely. And I think some of those sorts of privileges or benefits or incentives is going to probably be coming down the road and really helping us get those vaccine numbers a little higher. There is actually an official proof of vaccine, your vaccine doses you can get. So if you go onto the Ontario booking system, ontario.ca/book vaccine, and you log in, you can actually print out a receipt showing your 2 doses. And that even applies if you didn't book your vaccine through the booking system. If you went to your family doctor, you went to a pharmacist, got both of your doses back there, that database is still linked in, will see your doses, and you can actually print off an official proof of your 2 doses of vaccines there. It's possible we could see something more formal come out right now, down the road, like a card. I think it was Manitoba or Saskatchewan actually came out with like a credit card that you get that indicates that you're fully vaccinated. But right now you actually have that option of ontario.ca/book vaccine to actually print off a little receipt there that is your official proof of vaccination.
Yep. Thank you very much. The government of Canada has announced a timeline to reopen the border for fully vaccinated non-essential travelers. Both to our friends on the American side and to the international traveler at the same time. What metrics would indicate that it's all right to go ahead and even create a further reopening of the border, knowing for personal interest, we have family, we have friends there, for business relationships that are being conducted, but also for some of our sectors that are heavily dependent on the international traveler?
Yeah, I think in general, what I'm pretty concerned about is people coming from an area where there's high numbers of cases or high numbers of a variant bring those infections here. So watching for travel-related infections, I think, would be key. Actually, in Niagara, unfortunately, in the last week, we've had actually 3 travel-related cases, at least 2 of them in actually fully vaccinated travelers. Not a huge number, and I think we had the 3 in 1 week, but we had none the previous week. But watching that stat to see how much travel-related cases are filtering into the country, I think will be a key metric. If we're seeing a lot of those coming, I think that should give us caution about continuing on the road of reopening the border. If we're not seeing many, I think we can keep taking small steps forward with, the next step being US fully vaccinated travelers that I think is August 9th was announced. Early September, the hope is then fully vaccinated people from around the world could enter. And taking those small steps where you're not completely opening a border, but fully vaccinated people pose the lowest risk on a stepwise basis, allowing more people in. I think that's a sensible and careful approach to proceed.
Makes sense. Thank you. We often in past webinars that we held with you, we actually talked about herd immunity. And do we know, has the magic number for herd immunity shifted? What percentage of all people, eligible people and adults need to be vaccinated to keep the rest of us safe?
Yeah, that number has shifted with the Delta variant because it spreads more easily, so we need a higher vaccination rate. And unfortunately, the vaccine isn't as effective against the Delta variant, which also means that we need a higher vaccine rate. So the current estimates I'm seeing for herd immunity are actually in the high 90% of people fully vaccinated, which right now isn't actually even doable given that 11% of Niagara's population is under the age of 12 and can't be vaccinated. So I don't think we're looking at herd immunity as in something near term that we can expect. What I'm really focused on is a 75% where we're fully dosed. We are not going to see an overwhelming surge of cases that, overwhelm our healthcare sector. And I think if we can get there, that's a really good point where we can hopefully reopen most things and then keep working at continue to drive that number up and maybe someday getting over 95%.
Thank you. Just looking at those individuals who have or cannot get vaccinated due to medical or religious or philosophical reasons, what does that future look like for those individuals? How can we accommodate them? They are our neighbors, they are friends, they are our family members, our co-workers in some cases. How do we accommodate them? What does the future look like there?
Yeah. So, I think the future there would look like, say, something like measles vaccine, where we don't really have measles in Canada anymore because we have enough people vaccinated. And the few people who are dead set against vaccines or have a medical reason they can't be vaccinated are basically protected because everybody around them is vaccinated, so the virus doesn't have the ability to spread. Effectively getting to something close to herd immunity or herd immunity. So I think the higher the rest of us get our vaccine coverage, the more we're going to be able to make sure those groups are protected. I think if you have family members, people close to you, and you're going to be around them, try and make sure you have gatherings and events where you have almost everybody fully vaccinated to really kind of in that small pocket of people create that kind of protective herd immunity type bubble with them.
Yeah, thank you very much. And actually on that note, I am going to share in our chat a link actually to a survey that we're running right now, because we wanted to kind of gauge if people are willing to go to in-person business events again. And we really, to all people who are with us today, we really encourage you, take a minute. It takes less than a minute to fill out, but we wanted to get the sense of the openness towards engaging again in person, because there is such a wish for people to do it, but are we ready for it at the same time? So we really would appreciate your feedback on that. And there are two more questions that have come in. There have been recent calls for vaccination to be mandatory for healthcare workers. Do you think that this would be a good policy? And on that same note, are there any other groups or industry where mandatory vaccination makes sense?
Yeah, I am favorably inclined to requiring vaccination in healthcare facilities. We actually do require other vaccines in many healthcare facilities, and we've of course seen lots of people have gotten sick in hospital outbreaks and long-term care home outbreaks. So I think we really have a duty to patients we're caring in those facilities to make sure they're as protected as possible. And so I would really lean to in a healthcare facility, most people should really be forced to be vaccinated. Outside of that, I don't really think we need to go there yet. We're not seeing other places where we see that same level of serious illness and death caused by the vaccine. But I don't think we should also rule it out either. There may come a point where we are facing an fourth wave, and it's a choice of, do we bring in new lockdown measures or do we force people to be vaccinated? And at that point, it may make a lot more sense to force people to be vaccinated. Takes away some freedom, but you're taking away freedom when you shut down a whole bunch of businesses and possible social activities people can do in society. And at least with forcing vaccinations, you're not hurting the economy in the process. So I don't want to close the door to it, but I would like to try and get people voluntarily vaccinated as much as possible. And I think there's lots of room to make vaccines really easy for people that we'll be able to get the number up.
Thank you. And then on that note, in some of our webinars, you spoke about the potential of booster shots that are needed for those who have received both vaccinations. Is that in the near future? Are we looking at that early next year, or sometimes often in 6 months from now or 9 months from now? And then lately we hear that that is not necessary. Yeah,
the research more and more seems to be showing that the vaccines we're predominantly using in Canada, Moderna and Pfizer, these protection from that really seems to be lasting a long time. People a year now are in the research studies initially getting those vaccines, and they don't seem to have had any waning of their immunity. So it's not looking like a booster dose is going to be needed. And I think if, even if there's a small waning of immunity or a small incremental benefit of a booster dose to help us against these variants, the much better use of that vaccine would be to send it to other parts of the world that don't have vaccine right now, that aren't vaccinating their population, so we can protect those people, save a lot more lives, and also stop variants from emerging that are going to come back and threaten us. I think that's really where I'd rather see vaccines deployed than coming back to us for a third dose.
Thank you very much. As we have only 1 minute left, last question that we have: how long are these vaccines, these 2 shots that most of us have gotten, are good for? How long will they last? And do we have to get revaccinated at one point?
It looks like they're probably good for at least a year. We're only going to know over time if we start to see them stop working, but there's some suggestive evidence that it's probably going to be many years that they're good for.
Thank you very much. And again, thank you very much for your time, for being with us today. We so deeply actually value it. We often get extremely good feedback from people too, and the engagement, even knowing that a webinar is coming up, is always high. For those of you who have joined us today, thank you so very much for being with us. This session has been recorded and is available on our website at gncc.ca. And if you have any questions, you know how to reach out to us. I think you have all of our contact information. So thank you again for being with us, and have a wonderful summer day.